Over 50 Cuban nurses set to return to strengthen Jamaica's public healthcare system. Jamaica's public healthcare system is expected to receive a significant boost in the coming weeks as more than 50 Cuban nurses prepare to return to the island under a new employment arrangement. The move comes as health authorities continue efforts to address long-standing staffing shortages that have placed increasing pressure on hospitals and health centers across the country. The arrival of the nurses marks another chapter in Jamaica's decades-long collaboration with Cuban healthcare professionals who have played a vital role in the country's medical services for many years. Earlier this year, Jamaica transitioned away from the previous government-to-government technical cooperation program, opting instead for individual employment contracts that comply with Jamaican labor laws. Health officials have indicated that the revised arrangement allows Cuban healthcare workers to work directly in Jamaica while receiving employment terms consistent with local regulations. Health Minister Christopher Tufton has previously confirmed that dozens of Cuban healthcare professionals chose to remain in Jamaica under the new contractual framework after the earlier bilateral agreement ended. According to the Ministry of Health, more than 40 Cuban doctors and healthcare workers have already accepted individual contracts, and the government has extended invitations to additional professionals wishing to return and continue serving in the country's healthcare sector. The expected arrival of the new group of nurses is welcome news for Jamaica's public hospitals, many of which continue to grapple with nursing vacancies caused by migration, retirements, and increasing demand for healthcare services. Staffing shortages have been particularly challenging in emergency departments, specialist units, and rural facilities, where recruiting and retraining qualified professionals has remained difficult. The additional nurses are expected to help improve patient care, reduce overtime pressures on existing staff, and strengthen healthcare delivery across several regional health authorities. The revised arrangement follows months of discussions surrounding the future of Cuban medical personnel in Jamaica. Earlier this year, the government announced that it had been unable to reach a new state-to-state technical cooperation agreement with Cuba after the previous framework expired. Instead, Jamaican officials opted for a model that allows Cuban doctors, nurses, and other healthcare professionals to work under direct employment contracts that satisfy local employment standards. Despite the contractual changes, Jamaican officials have repeatedly emphasized the country's appreciation for the contribution Cuban healthcare workers have made over several decades. The Ministry of Foreign Affairs and Foreign Trade has stated that Cuban doctors, nurses, and technicians continue to be treated with respect and remain highly valued for their dedication and professionalism while serving Jamaican communities. The recruitment of the additional nurses also forms part of a broader strategy to strengthen Jamaica's healthcare workforce. Alongside the return of Cuban professionals, the government has been pursuing international partnerships and expanding local training initiatives to improve staffing levels over the long term. Health officials say these combined efforts are intended to create a more resilient healthcare system capable of meeting growing patient demand while reducing dependence on temporary staffing solutions.
I was in Ghana and my team went back after and they have interviewed and they have some recommendations for a number of Ghanaian nurses to come. They're now talking to the medical council to deal with the approvals. We had interviewed some diaspora persons and that is now going through the final process.
If finalized as expected, the arrival of more than 50 Cuban nurses will provide timely relief for Jamaica's healthcare sector and reinforce frontline medical services at a time when hospitals continue to face significant workforce challenges. Officials hope the additional personnel will help improve access to care, ease workloads for existing staff, support better health outcomes for patients across the island. Subscribe today, turn on notifications, and never miss the stories that matter most. Jamaica News Now. Your Highlands, your news, right now.